So when I first started working for Athena Medical Group, I had designed this whole business plan and called it Glow Eternal for doing medical aesthetics. I had already had the Botox and filler training in Boston, and I had the whole business plan ready to go. And as soon as the medical director for Athena Medical Group found out that I offered those procedures, he signed on, and we kind of helped Glow Eternal come to life together, and it's now a part of Athena Medical Group.
And it's growing?
It is, yes. So Glow Eternal is just the name of my aesthetics business, basically, but within that I do Botox, dermal fillers, we do Coolsculpting, Kybella, a medi-weight program. So for Botox, we do small injections in certain areas of toxin, really, but it's also safe for this procedure. But it paralyzes the muscle, it helps thin, or it helps smooth out fine wrinkles, and also prevent deep lines from forming. Coolsculpting is a non-invasive fat reduction medical procedure. So we use applicators that act as a vacuum, and they kind of suck in the skin and fat in the area that you want to treat, and it treats it for an hour at -12°C, and it kills the fat cells for good, actually. Medi-weight is a medical weight loss program that we do at Athena Medical Group, and it's where certain patients, if they don't have pre-existing heart conditions or have kind of a delicate health history, they come in every week, and we look at their diet and exercise, and we kind of go into depth about that, and we monitor their weight loss, and oftentimes we will use a diet medication to assist in the weight loss. Kybella is an amazing procedure that helps reduce the double chin area. It's a certain type of acid that's safe to inject in this area, and we do small pinpoint injections, and over a course of a couple months it thins out the double chin area, but it also helps tighten the skin after removing the fat cells from here. So that's kind of an important aspect about it. So dermal fillers are for certain areas of the face. It helps put back the volume that people have lost with aging. We can do lip augmentation, cheek augmentation, jawline augmentation, and nasolabial folds. So there's a lot we can do with fillers.
Now, none of this would come under the heading of plastic surgery.
Nope, no surgery involved for anything that we do.
Because it's non-invasive.
Correct.
And so this is becoming more and more popular, these procedures you're talking about.
I always recommend to my patients to avoid any elective surgery as much as possible. It's just can be risky. The recovery process is horrible. 6 weeks of pain and tubes and staples, and the procedures that we do here are much less invasive and easier to recover from.
Gary, you're a PA?
Yes.
So tell me what a PA is.
A PA is a physician assistant. We essentially do the same things that a doctor does, however we don't have our medical degree. We go through a really intense, most of the time it's 2 years program, and by the end of it we're able to examine patients, diagnose, treat, order studies such as x-rays, lab results, and interpret that and care for the patient.
Well, for the record, you're one of the best doctors I've ever had.
Aww,
so
thank you.
I'll take the PA. So where did you grow up?
So I grew up in San Jose, California, and also Santa Cruz, California.
Where did you go to college?
I went to a couple different colleges. For my associate's degree, I went to Heald College. I started out as a medical assistant. So I would room patients, do vitals, that kind of thing. And then for my bachelor's, I went to Ashford University. and I got my bachelor's in psychology.
And then your medical, where
Yes.
did you do that?
Then after I got my bachelor's, I worked on my master's in health science, and I was accepted into Stanford University's physician assistant program, and so I graduated Stanford with a master's in medical science and a master's in health science.
Great. And being a young doctor, you are constantly learning. You're still going to school, aren't you?
Yes, all the time. It's the field that you're in. It's always changing. There's always new things to learn, new skills to acquire. That's how I ended up doing the Botox and filler training in Boston a couple years back. The Aesthetic Skin Institute. It was to learn how to do Botox and fillers. It was an amazing, intensive course.
So Athena, is that out of Stanford? Is this where you started working, or did you work somewhere else before here?
So I worked at Palo Alto Medical Foundation and Action Urgent Care, and so I did internal medicine and urgent care for a couple years, and then I found Athena and started working here as family practice.
Now Athena has a bunch of doctors.
Yes.
Right?
Yes.
And I think I read online around 20 years that they've been in the area.
We're Salinas, Monterey, Seaside.
Those three. So you kind of rotate between the three. I want to go back to your childhood a little bit. What did your dad do for a living?
So
your dad and mom.
My dad is from Rome, and my mom was traveling Europe and met him there, and they decided to get married after 3 days. Then he waited 18 months and came here, and they ended up getting married, and they're still married today. But he sells Italian suits, and so he has been in the men's clothing industry as long as I can remember. And my mom, she was a recreational therapist for developmentally disabled people for a really long time, and eventually she was kind of one of the high up bosses at Agnew's Developmental Center. She helped serve so many developmentally disabled people.
Do you think that's where your your interest in medicine came from? Where did that start?
I think so. I mean, my family, I was raised to always just help others and serve others. My grandma, who I adored so much, she was a nurse, and she had a huge influence on me in that way. Just watching her growing up, I learned a lot, how to care for others, how to be compassionate, to have empathy, to really try and connect with people, and I think that serves me more than anything, because you can always learn something from a book about medicine, but having those kind of mannerisms or that type of personality, you can't learn that.
And so in this particular case, it's not like you're curing cancer.
No.
You're making people look better.
Yes.
And that's very psychological, so you can change the look of someone. But there's another aspect that must go along with that, and that is the whole psychology of dealing with.
Yes.
I mean, everybody says beauty is only skin deep, and you're beautiful inside, and all of those things. So do you find that that beauty inside and only skin deep follows the treatments, that people start feeling more beautiful inside as well?
You know, it's an interesting thing, like you said. There's definitely a psychological process that goes along with this. I used to be against any kind of physical augmentation for aesthetic purposes, but after turning 30 and having 2 children, I fell in love with these procedures. It's kind of interesting. The minute that I did Botox on myself and eliminated my crow's feet, already I felt more comfortable in pictures. I didn't wear as much makeup. It does kind of bring out that sense that you're looking better, and that's really priceless, because it increases your self-esteem and just
your self-confidence.
Self-confidence, so many things, and to be able to give that to my patients as well, and they are so thankful, is an amazing feeling.
And they do come back to you and talk and tell you what it means to their lives, right?
All the time.
All the time, and how it changes, and it does. It's a life changer.
It is, absolutely. It really is.
So, can we go in and see this being done? Can you
Yes.
show that to us?
I actually have a patient right now. She's getting Coolsculpting done, and we are planning to do a Botox on her. And let's go check it out.
Okay.
Okay.
So it's Andrea. What's your last name?
Andrea.
So you poor thing, you're laying in this bed. Tell me what's going on with you.
I'm having a Coolsculpting treatment.
Coolsculpting,
Yes.
right? And Chiara is doing this for you. Hello,
Yes.
Chiara. And so tell me, you've done this before? Is this the first time you've done it?
No, I've had multiple treatments.
You've had.
This is probably like the 12th treatment I've had.
Oh, I see. Are you in pain or?
No.
No?
It's just to keep the treatment positioned correctly.
Now we have a machine that we hear in the background, or maybe even the foreground over here. Chiara, what is that machine doing?
So this machine is from the company Zeltique, who created Coolsculpting, the original creators of Coolsculpting. And there's coolant in here, and the applicator that's attached to Andrea is from this hose here. And the applicator works as a suction or a vacuum over the place that you want to freeze the fat. So you place it on that area, and it sucks the fat in, and it treats it at -12 degrees Celsius for an hour. And Harvard doctors discovered how fat cells react to cold several years ago, and then Coolsculpting was invented. So it's actually Harvard-based science.
Well, you're going to tell me more about that, but it's non-invasive, and you didn't
Non-invasive.
no cuts or
Correct.
anything like that.
No incisions, no needles.
It's phenomenal, isn't it? That's really amazing.
Yeah.
I need a big one of those for my midriff.
We do have that.
Oh, good.
Yeah,
I'm
that's a
next.
big one.
So there's just certain parts of your body that you want to kind of hone. Was that the reason you're doing it?
Yeah, it's a refinement treatment. That's correct, yes. So you can use it on your abdomen, inner thighs, outer thighs, the flanks. You can use it on your back. You can use it on your arms, like the granny arms. The straight applicator, we use the cool fit. I think that's the one that's on my back too. It's this one, so we do just like this, and it takes. I mean, I don't really have a lot on my arms because my arms are pretty athletic, but I think it takes this bottom like flappy part off the arm.
Right.
Yeah, exactly, and it just makes them just more narrow.
So your knee, your
The chin.
chin.
Get rid of the double chin. People hate having a double chin, right?
The abdomen is, of course, the most popular area, but you can use it on a multitude of areas, yeah.
Right. And does she know what she's doing? I mean, you're going to vouch
Yes,
for her?
she does. She's very good at it.
She knows, and so she's led you through this treatment too.
Yes, she has.
Very good. So do you have more to go? Are you going to do more
I'm
of
going
this?
to do one more treatment today, yes, which is, just the other contralateral side to this, the other side of my back.
Great. Well, so you can eat all the ice cream you want. And just
it
pop
doesn't
in
quite
here.
work like that.
It should be right next door to Baskin Robbins, don't you think?
That sounds great, but it doesn't actually cause you to lose weight. It just takes off superficial subcutaneous fat. So, you can't eat everything that you want. It just refines, pockets of fat that are difficult to lose through exercise.
Right. So would you recommend this for other people when you're talking to them
Yes,
and they go,
I definitely would, because even if you don't lose weight per se, your pants fit better.
As long as you maintain what you were doing before you had Coolsculpting, you will get results. As long as you don't go crazy after you get the treatments and start eating all like, oh, I got Coolsculpting, now I can have all this stuff, then you won't see as good results. But if you maintain what you're doing, the treatments will be effective.
So this has only been around for how long?
Actually, it's been around for like 20 years.
About 20 years,
Yeah.
But it's gotten more popular
More
lately.
popular recently, and they've kind of really honed it down into really effective treatments.
And who would you recommend it for? What people do people come in and you go, no, this is not for you?
So It doesn't treat what's called visceral fat. So there's subcutaneous fat, which is just under the skin, and that you can really squeeze. So we say if you can squeeze it, you can freeze it. But the other, like visceral fat, where let's say someone has a large abdomen, but you're not able to kind of squeeze that fat, that's usually underneath the muscle, and it doesn't treat.
What about this stuff right here?
Oh yeah.
Yeah?
Yes.
Get rid of those forever?
Yes.
On the side. What do they call those?
The death handles.
Yeah, the death handles.
How does this machine actually work? How does the cold affect the fat cells? Because you mentioned that doctors have long known what cold does to fat cells. And what does it do?
So, doctors at Harvard had noticed that kids who ate a lot of popsicles had thinner cheeks, or equestrians who rode in the snow with big jackets but not thick pants, their legs were skinnier. So they started studying the effects of cold on fat cells. So when the applicator treats the fat cells for an hour at negative 12 degrees Celsius, what happens is it irritates the fat cells so much that it goes into what's called apoptosis, and the fat cell swells up and then shrinks up and dies and is excreted through your waste.
Wow.
Yeah.
So people in Minnesota really...
Yes, I know. Yes.
I know. If we go skiing, skiers.
Yes.
Right, 'cause
wear less clothes. You know?
Yeah. So this is more of a situation where you're looking at inches rather than pounds,
Correct.
right? So an average, if you're doing everything correctly, the way you're supposed to, an average treatment would reduce by how many inches? Or
So in terms of my results, generally, I mean, I've had people lose from 3 inches total to 18 inches total, just depending on how many treatments we've done,
Sure.
what areas. But it's really about every treatment that you do that reduces 25% of the fat cells. So we recommend no less than 2 treatments in one area to reduce half of the fat cells. And once those fat cells are gone, they're gone. They're not coming back. But you still have other fat cells that can get bigger if you don't take care of yourself.
I think we were talking about what your pain level was, I think a little bit. How is it to get this treatment?
It's pretty minor. I think I explained that before. You're kind of like sticking your hand in a bucket of snow. I mean, it feels a little like pinching. I mean, it's slightly uncomfortable, but definitely not extremely painful. I mean,
I've fallen asleep during the treatments, and I've had a few patients fall, you know, they look at it as their nap rest time, although the room that we do Coolsculpting in, it has Netflix, a big fireplace, these comfortable chairs, so it's actually a really good room to have Coolsculpting done, is because sometimes you're here for several hours, but I've seen people fall asleep.
Now, does the patient have any relaxation medication or anything?
It's available if needed. Yes.
Okay, so
if they're especially nervous about the procedure or haven't had it before, usually it's just the anticipation, and once people have it, they're totally fine with it.
Is it very expensive?
Good question. That's probably the biggest question that I get. Everyone differs really, because everyone's body type is different, and so we may need multiple applicators for different areas, and it just ranges just based on body happiness. But we do free consults, and we can go over how many applicators you would need, how many sessions, and give you an estimate.
I get the treatment and I walk out of here and I'm a different person?
Not immediately, unfortunately. So after the treatment, most people feel great. They can go back to work or do their normal activities. There's no downtime. However, with Coolsculpting, you do have to be patient. For the maximum results, it takes about 3 months, because you have to wait for the fat cells to swell up and shrink and be excreted. However, most people start noticing results within 2 or 3 weeks. And it's actually kind of nice, because every week you look in the mirror after you start seeing results, and it's better and better and better. And next week, oh my gosh, it's better than last week. And you'll get that for 3 months.
Right.
Yeah.
So do young people come in and go, a young lady who's like 21 years old come in and want to do this?
Yes. I've
Really?
definitely had.
And how do you feel about that?
Well, I discuss all the, risks versus benefits, and usually A lot of them do the medi-weight program that we offer here along with Coolsculpting, and that's actually the best result.
What is that?
Medi-weight program is where you're coming in weekly, we discuss your diet and your exercise, you're being monitored very closely, and as long as you don't have any other health conditions that could potentially be dangerous, we do use a diet medication as well. And so that's only for certain patients, but I've noticed that that combined with Coolsculpting gets really, really good results.
Okay. Makes people's lives better.
Yeah, it really, I mean, that's one of the things that I love about doing this. It's so rewarding because even last week I had a patient tell me how much I have helped change her life, also just by giving her encouragement, showing her her before, you know, putting together her before and after photos and saying, oh my gosh, look at these changes. She just really, she was like almost tearful how thankful she was to me. That was just so rewarding, and I love it.
Yeah. Well, it does change people's lives, right?
So it's pretty much like you said she had it on for 50 minutes, and then you relax or you take it off and then massage.
Yes.
So
60 minutes on the applicator, and then 2 minutes massage.
Fantastic.
Yeah.
How did you learn how to do this?
Through Coolsculpting University.
Oh, where is that?
It's in Pleasanton, actually. That's where Zeltique, the company who invented Coolsculpting.
Oh, they're actually in Pleasanton.
Based in, yeah.
Wow.
So it was a 3-day, and Andrea went too. It's a 3-day crash course, and it was really a great experience. I just learned so much, and basically you come out of there being able to do it.
So tell me what we're doing here, Kiera. This is called the Botox treatment,
yes,
right?
this is Botox, and we'll be injecting Andrea for certain areas. She's an interesting patient because she gets Botox for migraine treatment, and she just had her last migraine Botox treatment about a month ago. So this area actually we won't be doing. What we'll be focusing on is the glabella area, and over the eyebrows, the crow's feet on both sides, and the bunny lines. There we go, there.
Those are bunny lines.
Yes.
And so have you had this treatment before? It works?
Oh yes, it works. She does a great job.
Yeah.
Thank you. Okay, so I'm just going to clean the area with alcohol, so close your eyes for me. So we use a very, very small needle since the injections are of minimal amount, and that way you don't make large punctures in the skin. So great, try and crease your brow down for me. Okay, all right, you can relax. Basically what Botox does is it paralyzes the muscle so that it softens, wrinkles, and also can help prevent deep lines from forming. Andrea has a high pain tolerance, but it's actually not a difficult procedure to have without anesthetic, since the puncture points are so minimal. It is good to, after the treatment, account for not being able to lie down for about 3 hours. You just want the Botox that we injected to stay where it's supposed to stay, so that muscles that we don't want to paralyze get paralyzed. And
so you can't lay down.
right, just for 3 hours. And it's the only time that I'll probably tell you not to exercise. So besides Botox, Andrea, she gets filler treatments as well. So, and she's had filler treatments before, but since she's been with me, what we've done is cheek augmentation, which enhances the cheekbone area and also lifts the nasolabial fold right here, so it helps to soften that. And also, if you have any drooping, like, I don't want to, you never had a jowl, but some people have a jowl down by their jawline.
Starting.
Yeah, no, well, we'll fix that. But when you put filler here, it actually pulls that up, softens the nasolabial fold, and enhances the cheekbone. It's almost like a mini facelift. We lose the collagen in our skin there, and the filler just helps replace it with. The filler is hyaluronic acid, but it acts as like a collagen. Okay, so we're going to do your bunny lines.
Okay.
And so the bunny lines are actually a little tender. They're totally tolerable, but they do make your eyes water a little bit. So squint your nose for me. And relax. And that's a tough muscle to paralyze, so we actually have to use quite a bit of units for Andrea. And also myself, we use 4 units on each side. At Glow Eternal at our practice, we charge for Botox by the unit. And everyone's a little different, depending on what areas you want. Can you look that way for me? And then squint your nose. And relax. Okay.
How long does a treatment last?
Oh, good question. It lasts about 4 to 6 months. And like Coolsculpting, you don't see results right away. The optimum results are in 2 weeks, so I usually have my patients come back for a 2-week follow-up so we can see their results, take before and after pictures, make sure they're happy with their results, and if any touch-ups need to be done, we do it at that time. But some people start seeing results in as early as 3 days, but the best results are within 2 weeks.
So how does it feel? Is your face numb?
No.
No? You don't feel anything, huh?
No, it doesn't change the feeling in your face.
It doesn't, huh? Interesting. Thank you very much, Andrea. Thanks for letting us bust in here.
No problem. Have a great day.
So, what do you get out of, first of all, what do you get out of being in medicine? And secondly, what do you get out of doing Glow?
So, with my family practice, I love it because I get to see people coming back on a regular basis. We make sure their blood pressure is good, their weight is good. We monitor their blood work or any health conditions that they have. And so when I work with my patients and see them coming back and actually practicing what is needed to improve their health, it's very rewarding to be able to guide someone in doing that. You see how happy they are, how it changes their life, and it's incredibly rewarding.
And it makes you feel like you're making a difference in the world, is that it?
Absolutely, in the community, and that's really important to me.